For the radial nerve injuries objective part of the assessment, I will be checking for the general appearance of the patient. So upon entrance, I would be noticing the patient would have significant wrist drop due to weak wrist extensors, and I will check for VAPS scale to check for the pain, and the patient will report of lightning-like pain at the posterior surface of the humerus that radiates to the fingers as well. Now for the neurologic assessment, I'll be checking for sensory and DTR. So for sensory assessment, I will be checking for light touch, pinprick, pressure, and temperature. So for light touch and pinprick, I'll be using a reflex hammer. So ma'am, I want you to put your hand on the table. So I will introduce to you the sensation. This is pinprick. Can you feel it, ma'am? How about dull? Okay, so tell me, ma'am, close your eyes. Tell me if it's light touch or pinprick, okay? I'll be putting the sensation in the affected areas of your arm.
Pinprick, 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 light touch, light touch, light touch, light touch.
Okay, so the way you'll do this assessment is that 10 times light touch, 10 times pinprick. And then for the next set is you'll combine light touch and pinprick and make sure that they could be able to correctly identify between those sensations. Similar assessment goes for temperature and as well as for pressure. Now for the DTR assessment, I will be using the Hapon MAM on my reflex hammer. Then I'll be checking for your brachioradialis reflex. So it is 2 finger breadths proximal from the radiostyloid process. So it will be done as so like this. Okay, so the patient would present with areflexia or hyporeflexia of the brachioradialis reflex. Now for the sensory, there will be a paired sensation as light touch, pinprick, pressure, and hot and cold temperature at the posterior arm, lateral aspect of the dorsum of the hand, and as well as dorsum of the digits 1 through 4. Now for the musculoskeletal assessment, I'll be checking for ROM and MMT. So for ROM, ma'am, range of motion is for me to check if you have any limitations of motion on your upper extremity on both forearms. So can you please situate your, yes ma'am, very good. Now for range of motion, I will be checking for wrist extensors, which would go like this. Fulcrum over the lateral aspect of the triquetrium. 3, 2, 1 off the table. Very good. Now I'll check for finger extensors. So fulcrum over the IP joint. 3, 2, 1. Index finger sac. Very good. Then do as well as the lateral 3 fingers. Then for the elbow flexion, I want you to bend your arm towards you. 3, 2, 1. So it is found at the lateral condyle. Okay, the fulcrum. And then after that, for the MMT, this is for me to check, ma'am, if you have significant muscle strength on certain areas, okay? So for wrist extension, bring it up like this. Don't let me push you down. Very good. So for fingers, I want you to extend as far as you can off the table. Don't let me push you down. Very good. Now for supinators, I want you to do this. Don't let me bring your arm towards, bring the hand towards facing the floor, okay? 3, 2, 1. Okay, resist. Very good. Now for elbow flexion, bend. Don't let me push your arm down. Very good. So for this significance, there will be limitation of motion as to wrist extension, finger extension, and elbow flexion. And MMT, decreased muscle strength as to wrist extensors, finger extensors, and supinators, and as well as mild weakness as to the elbow flexion due to brachioradialis involvement. So for the coordination assessment, what I will let the patient do is do coordination assessment, finger to nose, as well as oppositions. And then last but not the least, pronation and supination, in which they will be recorded as impaired. For functional assessment, they will be impaired as well as to functional capacity as to dressing the upper extremity, eating, and personal hygiene. And for the special test, ULNT3. So what the patient must do is depress the shoulder, then straighten the arm away from the body, then bend the wrist and elbow like this, and ulnarly deviate away. Then what they can also do to further stress the patient is to bend their head. So the patient will report of positive pain, tingling, or numbing sensation. So for the plan of care for the patient, we will provide patient education as to the disease and its progression and energy conservation techniques to improve the functional capacity of the patient without any discomfort or fatigability. Then prescribe a cock-up splint to the patient to maintain the wrist and fingers in an extended position. And for pain relief, to stimulate the nerve fibers of the radial nerve. So you will do conventional mode TENS with a pulse width of 50 to 125 milliseconds and a pulse frequency of 50 to 100 pulse per second. Now, for the neurological impairments, for the sensory impairments, we will do resensitization techniques using mga multiple textures for 12 reps, 3 sets on the posterior arm, lateral aspect of the dorsum of the hand, and digits 1 through 4 at its dorsum. So, from the pinaka harshest texture to the lightest texture is the concept of resensitization technique. So, the affected areas, I will apply the sharp sensation. Then, assuming na this is the sandpaper, the second texture, I will just raise it over the affected area. Then, last but not least, is the cotton. So that is resensitization technique. And then for radial nerve flossing, this will be done for 10 reps, 2 sets to mobilize or decompress the radial nerve. So for the radial nerve flossing, ma'am, what I want you to do is pronation, supination, like that lang. Then, the same what we did for the special test, ULNT3. This is called the waiter's tip, like this. Can you stand up, ma'am? Waiter's tip. Then, sit down, balik, ma'am. So what I want you to do, ma'am, for this is I want you to bend towards your shoulder, then away. Okay, straighten the arm, ma'am. Okay, bend, away. Bend, away. So those are the two radial nerve flossing that you should do. The next is arm exercises. So what I want you to do is to extend your wrist like this. Like that. Then ball fist going up, 4 finger extensions. Then supination gihapon. Then elbow flexion. Okay, do those for 12 reps, 3 sets. Then for strengthening exercises, we will use a 12-pound dumbbell. Each will be done for 10 reps, 3 sets. So our hand off the table, wrist extension, bring it up. Okay, very good. The next would be elbow flexion. Okay, bring towards you. Very good. The next would be pronation, supination. Okay. So those are the things I want you to do for strengthening exercises. Okay, ma'am? So next would be coordination exercises for 10 reps, 3 sets to improve your muscular control and stability of your upper extremities. So what I want you to do, ma'am, is similar to the coordination assessment. I want you to do finger to nose. Okay, very good. The next opposition, and make sure to highlight, you'll extend your fingers, Jude. Then, like that. Okay. Next is finger lifts. Like that. Going towards the first. Then, balik. Okay, very good. The next is pronation and supination gihapon. Arms forward raise. Then, pronate, supinate. Okay. The next, for the last part of DPOC is ADL training as to dressing. So you could make the patient button up a polo shirt or wear fold up a polo sleeve. For eating, you could let the patient eat with a spoon and fork or cut mga fruits or vegetables with the knife and a fork. Then personal hygiene, you could let the patient floss or brush their teeth or put a toothpaste onto the toothbrush for 10 reps, 3 sets to improve the functional capacity of the patient in and out of the home.